He's come in with neck pain. And I asked my staff member, I said, listen, what are you treating? What are you doing? He's like, I'm treating his neck and I'm doing this corrective work and this and this. I said, well, hang on. I said, this guy's in a heightened stress response because he's in a fear response if he's not breathing. And the nerve that supplies the diaphragm and the adrenals is the phrenic nerve. So it comes out of the vertebrae C345. So I said to him, you know that his emotional issue is never going to allow his neck to stabilize because this kid was never recovering at night because he wasn't sleeping at all. But it had really nothing to do with the musculoskeletal system. And he had come to our business to get help. But we would have been wrong if we just kept treating that neck.
Welcome to The Body Never Lies. I'm your host, Leela Lutz. Each week, myself and experts from around the world help you uncover the secret ways your body communicates with you to empower you in your own individual health journey. I am so excited to be back with the show, and I'm so grateful for all of your DMs and messages and emails asking me, when is the show coming back? And here it is. And I'm super excited today because I have a really special person, someone very important in my life, coming on as a guest today, one of my greatest mentors. And we're going to talk about holistic health and what is holistic health. Now, I don't know how many of you know, but I actually started in the industry as a personal trainer back in the early 2000s. That will let you know how old I am, but I very quickly became interested in the CHEK program thanks to a great PT manager that I had, Donal Carr, and so began a long career journey of working my way through the CHEK Institute to become a level 4 CHEK practitioner. And I really want to share with you today how we look at health holistically. And of course, I have gone on to do other things. I became really interested in functional endocrinology because I really felt like the nutrition knowledge that I had really wasn't getting to the root cause of why people were so fatigued and why they were getting injured, and, you know, really understanding that energy and metabolism and performance. But when I'm working with the physical body, I'm definitely still very much a CHEK practitioner and using Paul Chek's totem pole assessment to get to the root cause of an issue. And most any of you that follow me on social media will know perhaps that I had actually 4 years of orthodontics to correct a jaw issue that I had for many years, because it was having an effect on my entire body and hindering my performance and the way that I wanted to be able to live. And, you know, I really felt like I had to go down that journey of doing that to be a level 4 CHEK practitioner, because that is one of the things that we work with, the upper quarter. So I'm really looking forward for you guys to meet Suzi Nevell today. Suzi Nevell is an amazing physiotherapist, and she's had this amazing professional career spanning more than 27 years. After some years of working with a variety of high-performance athletes and sports teams and becoming New Zealand's women's trampoline champion — I knew I was going to stuff that word up — Suzi moved to the United States. And while she was there, she was invited by Paul Chek to join the CHEK Institute senior teaching staff in San Diego. And over the course of the next 16 years, she absorbed Paul's teachings on blending physical, nutritional, mental, emotional, and spiritual coaching into a coaching model for health. Now, today, Suzi brings all her experience, professional expertise, and philosophies on life, health, and wellbeing for the benefit of her clinic and gym, Suite 7, back in her hometown of Auckland in New Zealand. And I'm very excited to have her here today to talk about the foundations of holistic health. I'm so excited to have Suzi Nevell on the show today, guys. Suzi is one of my biggest, greatest mentors. She still mentors me at the moment. She's like my supervising physiotherapist, helping me with all my casework and helping me understand injury and work out what I'm going to do with clients. I'm so excited you're on the show today, Suzi.
Oh, it's great to be here. Thank you for having me.
You're so welcome. I really wanted to talk to you today about holistic healing and what it is, because really having an understanding of that, you teaching me that, learning from other practitioners as well, but mostly you, that has helped me so much as a practitioner. One, to be able to really get to the root cause of an issue for a client, and create a really strong program for them to be able to, actually achieve this idea of health. But also, it's really helped me as a practitioner step away from owning the client's outcome. And it's also helped me as a practitioner treat in a way where I'm not giving away of myself. And I just really look forward to coming to work. And I think for a lot of people, we are going to talk a bit about the CHEK program because that's where we've both come from, but working with a CHEK practitioner at this high level has really helped them, with all our other tools as well, has really helped them find something that they've been an answer that they've been looking for so long. And even if I don't end up working with someone, I can ascertain what the issue is and send them to the right person. Yeah. And I think the big thing that we are here for is helping people with chronic issues. And that's generally what people come to see us for. I'm saying us, even though I still look up to Suzi very much and need her advice a lot. People are certainly going to Suzi more than me. But generally that's what people look for when they look for someone like us, is I've had this injury forever, or I've had this chronic health issue for such a long time. I've seen hundreds sometimes of practitioners and everyone's told me to do something different. I'm so overwhelmed and I still have the injury, and now I'm just getting really pissed off basically about all the money I've spent and all the time that I've spent, and I can't work out what's going on. And that's what I love about what I've learnt through the CHEK program, what you've been teaching in the CHEK program for many, many years, is this ability to ascertain the root cause of something.
Yeah. And that's very much the group of clients I see, and we almost have it on our webpage. We address or we deal with people that have kind of sort of failed in the current system. Mm. And, the biggest challenge to that is that our sessions are at minimum an hour long. And in this age as well, when everyone wants everything to be done really quickly, it's really important that when we get these people in, that I say to them right away, look, how long has this been going on for? Well, it's been there for 20 years. Okay, so I want you to understand that we're looking at probably 2, maybe 3 years before this is addressed, because you can't fix a 20-year problem in 3 weeks, and you can't fix it in half-hour sessions. And so, to get people on board, I have to really educate them that way. Otherwise, they're constantly coming and going, it's no better. And I'm like, okay, we've had this discussion. So I think that you're right, that the CHEK totem pole of assessment and applying the foundations of health to the whole program has been just an amazing approach for me. I remember when I first did the CHEK course, really thinking to myself that I had done a bunch of postgraduate training, that I was being really lazy as a physio. I'm like, shit, I know all this stuff, but I've not used it. And here's this guy, Paul Chek, who has taken this all this information that I know, but he's put it together in a model. And it was the model that made me go, yeah, this is what he's done. He's taken that hard work that I didn't know how to put together. He's used all these great technicians and he's applied it into a model of assessment. And that was the model that, really caught me on board. It was the fact that, okay, now I'm going to be thorough. I know I've done my job, and now I can really start to problem solve because I've done a really thorough assessment. The totem pole assessment is something that I know we're going to talk about, but that's been really, really, really influential. And I think that for any CHEK practitioners who are listening at the moment, and I'm going to be saying that I was guilty of this. If you have learnt the totem pole assessment through the CHEK training and you are still sort of not doing it, you'll get the same results that I used to get. I used to go, and when I worked for Paul Chek at the Institute, I used to go and see him, and I'd be like, Paul, can you help me with this client? And he's like, well, did you follow the totem pole? And I'd be like, oh, no. He's like, well, go and do it. And so he'd make me go back and do it. And so that was how I had to really learn it, because he wouldn't help me if I hadn't done my assessment. And so, yeah, I tried to take the quick way around it, and I got my butt kicked every time, because also by not doing the assessment, I wasn't really able to problem solve. And so I had to go and ask him for help. And then he just turn his back and go and do your job. So, yeah, I went and did my job. You guys out there, you got to do it. And I think this is the great thing about what I've discovered with you, Leila, is that you are really following your totem pole assessment. And, you know, there's a lot of CHEK practitioners out there that are clinicians, they are seeing clients, but they're not doing that. And, if you want the best out of it, that you follow the model that he's created. That's been the best thing that I think I've got from him.
And then within that, you know, you add your own stuff to it, you know, like you introduced me to Guy Voyer, and, you know, done a lot of that work, and we've, you know, you add your own things to it. And Mark Buckley taught me a lot, and he was on another podcast saying the same thing as Suzi, like you don't get stronger in the gym, you get stronger at home when you recover. He taught me so much about strength training and, you know, actually really getting people super strong beyond that point of rehab that I needed to learn. So, but you're always learning, hey, but I always come back to this model of assessment.
Yeah, and that's the thing. I've learned loads of other things, but I don't change my assessment. So I've spent a lot of work with Guy Voyer, working with fascia, and I love the ability. Just like when I met CHEK and I was super motivated by that learning, I also am like super motivated by Guy Voyer's learning, and because I'm learning another level of anatomy. And yet I still do the totem pole assessment. I haven't really added anything else in that's new over the years. I mean, I've worked for CHEK since 2000, and then took some time out. I had a bit of a sabbatical, and in that time I studied Guy Voyer's stuff, and I've learned a lot of treatment approaches and approaches where clients can do more on their own, and that technique was really bridging the gap between some of the clients that I wanted to take into strength training, but they weren't quite ready. And there was another amazing tool in the toolbox that I got there, but I didn't really get anything from assessment there. Based on the level of learning I've done with Guy, I know there's Guy's stuff takes you into assessment. I just haven't had the ability to go and study that yet, because most of it's done in Montreal, which is a huge mission from New Zealand.
Oh, especially right now.
Yeah, and it's not happening now. But it was that totem pole assessment that, you know, I say to any of my students when I'm teaching a CHEK course, just make sure you get the CHEK exercise coach and level 1. It's now IMS 1, 2, and 3. Make sure you get that assessment down. Do it in an hour if you can. Boom, you've got an incredible amount of information. And the amount of clients that say to me when I'm doing, even if it's just IMS 1 or 2 level, that used to be the old CHEK exercise coach and CHEK level 1 and 2. Even when I'm doing that, just even doing that level of assessment is enough to take you and just give you the information that you need, and then you'll be able to really be above and beyond what's going on out there. And your clients always say, I've never had anyone look at me like this. But just even the other day, I had a guy come in to see me who had a huge amount of scar tissue in his neck from a cancer that was removed. The scarring had all completely contracted, and there was a big gap where virtually his levator scapula had been removed, and he was in a huge rotation right through his body because of this. And, you know, it had been years, he'd had this scarring for a while, and when I did the assessment, and I was running really late, and I really shortened it because I really just wanted to get my hands on that tissue. But he said to me, in the minimal amount of assessment I did, he's like, nobody has ever looked at me like this before. Do you do this with everyone? And I'm like, yes, but I do a lot more than this. This is kind of basic. But for him to say that to me just blew my mind. I'm like, here's a guy where you've got an obvious, clear reason why you need an assessment. There was a huge scar showing and a big gap in his tissue, and no one had done it.
I think for those people it's so important too. I often say that to people, often say that to me too. I feel seen and heard, and I've never felt that before. And especially with something like that, God, there's so much emotion with having cancer like that and then having it cut out of you. And then, you know, the emotion of having a disease but then being left with the battle scar of the disease. And I think we have this certain expectancy, you know, it's like mothers who have C-sections and that they didn't want to have, and not having that scar treated afterwards and retraining the abdominal wall leaves them feeling more damaged from the emergency surgery than they should be. Yeah. You know, and that's a real horrible thing, I think, in treatment for any injury or kind of outcome that we're able to help people with.
Yeah. And, you know, those scars, you can have a scar for 20 or 30 years and it will shut down all the muscles beneath it if it's not taken care of. So if that scar is not moving, so, for example, your cesarean scars, if they're not moving, it doesn't matter how good your abdominal training is. You're not going to be able to activate the abdominal wall properly because the scar will continue to shut that down. So therefore, you've got this naked spine that's now no longer has its corset working, and so now you're prone to sacroiliac, hip, knee, spine injuries, all because a scar in the front of the abdominal wall hasn't been addressed. Maybe keloid, or, you know, just adhered to the tissue underneath. That's why I love my manual therapy.
You do. You like getting off on it. She's quivering, everyone. She's quivering. You can't see her, but she's quivering.
Even though my hands are destroyed, and I'm just waiting for total joint replacements and when I'm in my 80s, and then I can keep going. But, yeah, this is another thing I think, that when you have the tool of the assessment and the problem solving, you need to have another person in your world, if you don't do it yourself, who does hands-on work.
You do.
Yes. You cannot strengthen or stretch muscles that are unhealthy or in a facilitated or short and tight or spasmy sort of situation. Those tissues have to be cleaned out before you can get the best out of them.
And I love that too, about this whole program assessment and being able to, you know, write a journey for a client and go, okay, well, I've got someone with pelvic floor damage. I've got someone who can do manual therapy on pelvic floor, and I can work with them and tell them what the whole picture is, and can you slot in here and help me with this bit, and, you know, let's work together for the client. When you've got that whole picture and you don't own it, you know, then you find it so easy to work with other practitioners and communicate with them.
Yes.
And they just want to work with you because they're like, oh, wow, this is really interesting.
Totally. And you learn so much from their approaches. I have a group of therapists that is quite extensive, and I constantly refer my clients out. And that's one thing I just sort of learned over the years when I started learning more and more with the CHEK model, especially once we got into the nutrition and lifestyle factors, and also once we got into the emotional regulation and the ability of the emotional body to be affected. I started getting together a team. I've got I've got two osteopaths. One does craniosacral, one does osteopathic fascial release. I've got there's two different chiropractors that I refer to. There's a kinesiologist I refer to. There's a woman that does chakra balancing I refer to. You know, there's other strength coaches that I work with who have different specialties, like Olympic lifting coaches. You know, I think it's really important, as well as a massage therapist, a person who does myofascial release. and an acupuncturist, it's really important to not try and spread yourself too thin by thinking that you can do it all for this client, because that absolutely you can't. But you can be that coach who manages those allied health practitioners, and you send your client to them, but you keep an eye on that response so that you know always that who's doing the right work. And if you have an ability to keep using your assessment to follow up and check that your client's heading in the right direction, then now you are kind of managing it, but you're not having to do all that work. It's, you can't literally find enough hours in the day to do everything.
No. And sometimes you have to send someone away to go and work with another practitioner and say, come back and see me after with, this X, Y, and Z. Like, because if I just took your money right now and trained you knowing that, I wouldn't be able to get you a result.
Yeah, and I had a situation at my business. I have a couple of staff, so I'm teaching them as much as I can about this model of approach of treatment and assessment, and about the foundations of health. And one of the foundations I've added in to the 6 foundations of health that Paul Chek has, I've added in a seventh foundation, which is community. And, I think it's really important that we have our tribe and we have our community that supports us and makes us sort of hold us accountable. So the community is also in those therapists. But we had this client come in the other day to see one of my staff members who's quite young, and he's so hungry to learn and he's so into it. So we start talking about him, and this guy has not been able to sleep for the last 2 years since his sister committed suicide. And he's come in with neck pain. And I asked my staff member, I said, listen, what are you treating? What are you doing? He's like, I'm treating his neck and I'm doing this corrective work and this and this. I said, well, hang on. I said, this guy's in a heightened stress response, isn't he? I said, so what supplies the adrenal glands? What nerve supplies it? So I asked him for the nerve supply. And then I said, and what nerve supplies the diaphragm? I said, because he's in a fear response if he's not breathing. And the nerve that supplies the diaphragm and the adrenals is the phrenic nerve. So it comes out of the vertebrae C345. So I said to him, you know that his emotional issue is never going to allow his neck to stabilize, because the phrenic nerve, which is feeding 2 organs that are really affected by this heightened state of his sadness and his grief and his trauma that he's had from losing his sister in the way that he lost her. Now, just in saying all this, I didn't see this client. He's not my client. I was just simply, we were having a client Q&A that we do in our work once a week. So I'm just going from a place of not really knowing, but just offering up suggestions to him on how this guy, the staff member of mine, needed to refer this kid out. This guy would not have been able to help his neck pain because this kid was never recovering at night because he wasn't sleeping at all. But it had really nothing to do with the musculoskeletal system. And he had come to our business to get help. But we would have been wrong if we just kept treating that neck. We had to refer him out. And I could see the resistance in my staff member going, I really just want to treat his neck and help him that way. And I said, but you're not. You're just delaying what he needs to address, which is the emotional trauma, maybe the PTSD, whatever it is that he's holding. And he's got to learn how to breathe, and he's got to learn how to drop that sympathetic state before he can even try to heal. He's, with the sympathetic nervous system, when it's on, it's like a seesaw or a teeter-totter. The parasympathetic system is off. So his ability to rest and repair and regenerate is switched off. It's like a light switch because his sympathetic state is so heightened. And that, there's that connection from the organs and the emotions to the physical musculoskeletal body. And so we've had to really do some time with my staff member about letting him go and letting him go see somebody else and getting him to come back when he's able to address, the driver.
And then there's also the problems that, I think some practitioners can hold on to that they think it might be an emotional problem and it's not. You know, and I think that really helps you. You know, where I had a client in a clinic I was working in, and the massage therapist said to me, I can't get this lady to relax her neck. Every time she comes in, I'm treating her and trying to get, you know, doing all the tissue work, and it doesn't last. She comes back. And so I think she's really stressed. And I said, well, what happened to her? Did she have an injury? She said, oh, yeah, she had quite a full-on car accident. She's got this whiplash injury. And I think it's really important in those situations to always have emotion in the back of your mind. But we also know from having any damage to the multifidus, like you would in a whiplash, if we don't restore the function, they're not going to work again. And so that's just a biomechanical issue that needs to be addressed as well. So, you know, for her, I really didn't feel like I wanted to do emotional stuff with her. I wanted to give her some power back as well, because being in pain, like neck pain is awful. I've had neck pain and face pain and jaw. It's so awful. Like I wanted to give her some power back as well with that injury. And I don't actually know a lot of people other than level 4 CHEK practitioners who really know how to restore that function in the neck. And so, you know, that gave her so much relief that she was willing to tell me more of the emotional stuff going on in her life. And, you know, so it's like a kind of dance, isn't it? Like,
it's like you've stepped down. It's like a step down transformer. If you've got a power circuit that's, you know, when you've taken some of the energy out of the tissue by treating the tissue.
Yeah.
Now the system can kind of single out really anything else that's still ramping up the power. Like you've stepped down that level of energy, and the whole nervous system has down-regulated by getting that neck tissue healthier.
Yeah.
In a whiplash, 50% of the fibers of the deep neck flexors get completely blown apart, like literally torn to shred. And less so these days, I think, because of headrests on cars. But, you know, this is research that was a long time ago, and a lot of therapists don't actually get in and release those tissues in front. So you've got your sympathetic chain running right down the front of your neck there. So you've right beside the nerves that feed those muscles, and those nerves that got stretched in a whiplash is the chain that jacks up your nervous system. Now, until you release the tension around that and release the freedom and get that exoplasmic flow going back in the nerves, there's going to be no way that the body's going to be able to decide what's more important to work with, so it doesn't settle anything down. And, you know, by coming in and you helping her settle down her actual tissue, now the system is free to be able to look at what now is the priority to address, and the emotions come out. And you can bring them up.
And, you know, I think it's interesting as well that we so want the answer to just be one thing. And then if it was one thing or one cause, then we could just do one thing and then we would have this instant result. And I can speak personally from having an upper cervical issue. And obviously I had ongoing issues all my life until I started studying in the CHEK program, and Mark Buckley walked up to me in his way, because he likes to be really funny and say your head's not on properly and you better get that sorted out. But I could never get anywhere with my strength training. I always had like a real plateau with it. And I also had chronic sacroiliac joint issues. I had chronic migraines. Despite being a singer most of my life and having lots of singing training, I had lots of breathing issues, and it got to a point where I was like, if I'm going to be this person who's going to teach this stuff and help clients with it, I'm going to have to go and do the work and go on the journey myself.
Huge learning curve.
Well, it was massive. What it gave me a lot of respect for was how important it is to do that assessment, and how important it is to map it out for a client, and look after them. And that, you know, I've got a dentist that I work with, and he and I have such a great dialogue of like, what do you think is the problem? What do you think is the problem? So what should we do first? Okay. And I can say, can you do this? I'm not going to do anything until you've done X because Y won't work. And, we have this awesome dialogue. We'll both go, well, maybe that person needs to go off and have, we've got a great physiotherapist in Sydney who does laser work for whiplash, and she's amazing, and she works with us really well too. So we've all got this thing. So she'll go, I reckon you only need a couple of sessions, and then just go back to the dentist, and then he'll do this and go back to Leela. So the client's not wasting money and spending heaps and heaps of time, and none of us own the outcome for the client. So
yes, and I think what you raised a really good point there. So the sun is like totally blinding me. You raised a really good point about the priorities, like choosing the priorities of what to address. And I think another really good point you raised was we must listen to our clients. A lot of us think that we as an outsider know what our clients are going on, and our clients are really, really good at telling us the diagnosis. It's really amazing. If you actually just stop and listen to them, they'll tell you what to do. And that was a big lesson for me as well. And I sent an email out to my staff the other day saying to them, look, I want you guys to tell me what you think being fully engaged means. And I got these big, like, paragraph answers and, like, this all real academia. And I just wrote back and I said, listen, here's my 5-word answer. Listen more than you speak.
Yeah.
So, I think that it's really important, like that dialogue that you said between you and your dentist. It's super important for him to listen to what you say because you tell him a lot. And I think if we are too stuck in trying to find the solution through our assessment and we don't actually listen to them, then, once again, we're not doing them any favours.
And, I think what was key with that too was learning to accept. I was prepared to go a very long way to get better, and learning to accept that was extreme. So at the moment, the dentist and I have a client that we're working on together, and he said his email to me was, in short of having what you had done, which I think, and he actually said to me, this client is not as nutritionally stable as you. I don't think her bone mineral density is going to cope with having braces like you did. So I don't think that's a great idea for her. And that's really important to be able to have that kind of filter.
Yes.
So she would feel amazing if she had it done, but could she actually go through the treatment of what she needs to do to be able to do it? So, I had great nutrition before I went and had braces for a very long time. And people don't realise how much wear that is on the periodontal ligament to have your teeth held like that for such a long time, because your teeth actually move on a day-to-day basis every time you breathe. And so they didn't have that. And that was really tough on my body. It was exhausting. And the other thing is that what I've really come to appreciate is I didn't get my braces off and all of a sudden I was better.
Right.
I was actually getting really shitty yesterday, where I was, I'm trying to up my training at the moment, and I was going to do some single arm presses, and I realised that I just don't have any strength in my right hand to single overhead press. And then I'm thinking, well, I've obviously got more work to do with, go back to the totem pole and look at what do I need to do with my neck tissue, with my breathing and everything after that experience. Because, of course, I've had a baby and I've had other stuff going on. I haven't stuck to what I was meant to do. So I guess that's a really good thing to talk about from my experience, is the totem pole, and how do we know that my head wasn't screwed on properly, and that having $15,000, $20,000 worth of orthodontics was going to get rid of my migraines and actually increase my deadlift from, I could never get over 30 kilos, and then all of a sudden I could get to 100 kilos. So I'll let you.
The totem pole.
The totem pole.
I think we keep talking about. So it was created So Paul Chek created this, and it's really about the survival hierarchies. Like our body is set up to kind of buffer and deal with or compromise itself to allow us to survive. And, number one on the totem pole, ultimately, and this was more so in the early days when I was studying with Paul Chek, respiration, he calls it the wind of life. Respiration is number one on the totem pole. But since then, Paul has really moved ahead with his learning a lot and has really incorporated a lot more mind and mental, emotional health, spiritual, mental, emotional health. He's now a shaman, and, he has put on the top of his totem pole a sun and a bird, and really he's looking at ultimately your relationship with Source or God and energy, and therefore spirituality and energy, spirituality and emotions. He considers to be number one on the totem pole. I use the emotions, and when I'm doing my totem pole assessment, I will consider them as to be something that could float anywhere, and the emotions can influence any part of the totem pole when you're doing your assessment. So when I talk about the totem pole, really, I'm talking about our body, our physical body. So if we think of our physical body, it has a structure of organization around survival. And your emotions can influence how you breathe. So ultimately, your respiration, which is your number one survival mechanism in your body to keep you alive, you have to breathe, within 3 minutes, 6 with the yogis maybe, but before you start having problems. And so, anything that compromises your respiration, your body is going to try and do whatever it can to get you to get air into your system, to get oxygen in. So, for example, if you are born with a small airway, and the airway at the back of the throat is meant to be the size of used to be an old 50-cent coin. You've got the old 50-cent coins in Australia, so all these big things.
Yeah, those big things.
So the client holds.
I don't know what that's like in an American coin.
Yeah. Their airway should be about that size if you look at the back of their throat, and then they open up their mouth. If that airway is really small, the body's going to put the head forward to try and get them to breathe properly, and especially when they're eating, they're going to bring their head forward to make sure they can get that food down the esophagus and open up that whole area. But once your head comes forward, there's all sorts of issues that happen with that. So, we spend a lot of time as CHEK practitioners getting people's posture right. And yet if someone has a respiratory-driven forward head posture and they haven't assessed that properly using the totem pole assessment, then they'll do all these exercises and, have people doing all sorts of neck strengthening and bringing their head back and posture correction, and nothing's going to change because the survival hierarchy is that I got to get air in, so I'm going to put my head forward to airway and breathe. So we look in our assessment at how the rib cage moves, how it sits, how it positions, how the lungs, how the volume and the pressure change happens in the lungs. We're looking at the mobility of the bucket handle action of the ribs. We're looking at the breathing pattern, whether it's inverted or correct. Are they short, shallow chest breathers? We're really trying to get just as much information as we can about their breathing patterns. And there's all sorts of factors that drive an increased or an accelerated breathing pattern, and we could spend a whole 3 hours on that right now.
Exactly.
But, if you have a compromised ability to get in oxygen, you're going to have compromises all down through your system, and it's going to present as something down in the foot. Just a classic example, a client came to us with Achilles tendonitis, and he had about 9 centimetres of forward head posture. So if you drop a plumb line from the cheekbone to the collarbone, you're allowed between 1 to 3 centimetres before it starts loading the system in a negative way. And this guy had 9 centimetres of forward head posture. And ultimately, Paul listened to his breathing, and you could hear he had a really nasalated tone. So his airways his nasal passages weren't clear to allow clear breathing, and the guy was a mouth breather because he wasn't getting good air through his nostrils. And as a mouth breather, when your head, as soon as your mouth is open to breathe, your body can get thrown into a little bit of a sympathetic state because it feels or thinks like it's running from a lion. So, this guy's got an Achilles tendonitis, and he's got 9 centimeters of forward head posture. He's got a blocked nasal passage, and he's a mouth breather. So now he's got an increased sympathetic tone. And in Chinese medicine, the adrenal glands classically dump excess energy, or there's a viscerosomatic reflex from the organ of the adrenal glands into the musculoskeletal gastrocnemius. So the gastrocnemius is the long calf muscle. So here's this guy coming to us with this Achilles tendonitis. He's a mouth breather, and he's got his adrenal glands being stressed by the fight and flight reaction of potentially being a mouth breather. And he's now loading up his calf in a very tight way because of the adrenal viscerosomatic reflex into the calf. And we send him off to an ear, nose, and throat specialist to open up the nasal passages to stop him being a mouth breather, to bring his head back, to then stop annoying his calf and his Achilles tendon. And he's like looking at us going, but I've come to you with the Achilles tendonitis. What am I doing going to this ear, nose, and throat specialist? So if we hadn't addressed that with that totem pulse assessment, this guy, would have had all the treatment on his calf and done all the strengthening, blah, 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 and hadn't looked at his adrenal glands. He would never have got better. So I always loved that little case history. And I had a triathlete come to me. She was this amazing woman. She had, been a national cyclist for New Zealand in BMX and road cycling and mountain biking. And, she competed at the Commonwealth Games, and she comes to me and she's literally standing there in this huge curvature with 9 centimeters of forward head posture and, calf issues, and she wants to run. So it happens. It's real. It wasn't just a case history of pause. I actually got to see this, and I still have the photos of her because I was so shocked. She was in incredible condition. So anyway, then after assessing respiration, and a short, shallow breathing pattern will drive anxiety and apprehension, which then drives a short, shallow breathing pattern. So you've got an emotion that drives your breathing as well. So you need to address and make sure that this person's not in a fear holding pattern, which often is, dropped front panel, dropped sternum, light diaphragm, and, poor ability to use the diaphragm well because they're in such a holding pattern down here. And you can classically see it in elderly as they get older and they get slightly more fearful about life, and they collapse over. Now, that can be a structural kyphosis of the thoracic spine, but it could also be that diaphragm and is shortening and pulling them down. Well, there's another whole player in the respiration factor, and the emotions driving the breathing pattern, or is the breathing pattern driving the emotions. So just keeping a really open mind is really important here. The next part that we assess on the totem pole is the jaw, and the jaw ultimately has a huge connection through its nerve supply to many other parts of your body. So the cranial nerves, which are nerves that come from your brainstem, and they kind of hold hands. They're quite intimate with each other. So when one cranial nerve is affected, the others can get a little bit heightened as well. And it's like this little law of facilitation where, one system will dump into the next. And the jaw is fed by a cranial nerve. And also your facial nerve, which feeds a lot of the muscles that affect the jaw, is also fed by a cranial nerve. It's cranial nerve number 7. And then the cranial nerve number 5 is the one that feeds the jaw, the temporomandibular joint. So your body will do whatever it can to get you to eat so you can survive. Mm. And so if your teeth are not coming together well, then your body will shift in whatever way it has to make your teeth come together. So if you have a leg length difference, for example, or you have a pelvic torsion and it's pulling one shoulder down and it's pulling your jaw over to one side, your teeth are not going to come together. So your body's going to do a decompensation for that other compensation to make your teeth come together. And so treating the jaw is always a challenging area, but assessing the jaw, and you don't, I often say to people, you decide if you want to go in and treat the jaw, because it's like Pandora's box when you go in there sometimes. The emotions around not being able to express as well, and the jaw not moving well, and the pain that they get, but also not being able to eat, oral sex, communication, everything. We've got to be able to function at that level. So, there's a lot of emotions around these issues. But assessing it is really important, because then you know when you have to refer out. So you have to decide whether they go to a dentist, an orofacial surgeon, a person, an acupuncturist, somebody who does hands-on work, gets inside the mouth and releases all the tissues, and then comes back to you to do the exercises for that area and your postural correction. And just know for one thing, if your head is forward of the midline and you have forward head posture, your jaw will be pulled back into what's called retrusion, and your molars will come together a lot harder, and you will close and compress the joint. So again, if you don't address the position that they're holding their head, you're not going to also address the ability to improve the jaw. So, Leela, you've got a huge story with your jaw. I mean, you've had such a big deal with it.
Well, it's funny when you talk about the nerve supply, because I actually lost vision in my left eye, and because my jaw got so bad. Yeah. And everyone was like, what do you mean? And I'd been to see everybody, right, because I wasn't as educated in the CHEK program then. I was just starting out, and I freaked out because I couldn't see. And it was so weird. I couldn't even explain it to anyone. I just had this black line. It's like I couldn't see anything in my left peripheral vision. And I went to an ophthalmologist, and he was like, your eye's fine. I don't know what you're talking about. I've been to see all these people, and I thought, oh my God, I'm going to call a CHEK practitioner. Of course, why wouldn't I? So I went to see Peter van der Sandlacost, who's a level 4 in Bondi Junction in Sydney, and he stuck a cotton bud in my eyeball. This is all I understood it was at the time. And did all this manual work around my jaw, and all of a sudden I could see again, and I'm like, far out, man. I've been everywhere.
So the cotton bud, I'll just let the cotton bud technique that you use with a very soft touch to massage. You have 6 muscles behind your eyeball, and you can access them and treat them just like other muscles have trigger points in them. So do the muscles of your eye. And sometimes those trigger points in those muscles can actually influence your vision, or can influence your kind of focusing, or your scope. The telescope is out of my league here, but that was what he did to Leela, was he treated those eye muscles to see if the muscles were driving the visual issue, and then he treated the jaw. But it's the connection of that optic nerve with the trigeminal nerve, and the intimate nature of those cranial nerves. Which also, here's another thing with those cranial nerves, is one of them is the vagus nerve, and the vagus nerve feeds so many of your organs, and a lot of the nausea that people get with migraines or jaw pain associated with the dizziness and the visual issues, it all can be influenced by the vagus nerve that's holding hands with these other cranial nerves. And so, yeah, Leela, that's why it helped you.
Well, yeah, and I've had an astigmatism in one eye since I was 7 years old. And so an astigmatism is when the eye changes shape, the eyeball changes shape because of the pressure of the tightening muscles around it pulling the eye into a different shape, right? Which I didn't know, of course, when I was younger, because, in conventional medicine you just have an astigmatism.
Does that show that your jaw issue started way, way back?
Yeah, way when I was a kid. And, I had my first migraine when I was 7 years old. Yeah. So, and of course I had orthodontics like most kids when I was a kid for having an underbite, not really understanding that my palate hadn't formed correctly. And when you don't have a beautiful wide palate, there's not enough room for the jaw to form underneath it. So I just had these ongoing issues, and the orthodontics that I had when I was a kid were to pull my bottom jaw forward without addressing the problems with my midface. And so, of course, I just pulled on the joint and, totally stretched and destabilized the temporomandibular joint by pulling the jaw forward, and had this, disc issue in my jaw, and which eventually led to, in my 30s, losing my vision. Yes. And so it's really nice. Like, it's such a relief when you have loss of vision, someone helps you with it, because everyone thinks you're going crazy, and that's what I love about it.
And there's a really quick test you can do. Just hold your thumb and index finger beside each other, and it's called the rule of thirds. So each part of your face, the third of each part of your face, should match the distance from the tip of your thumb to the end of your index finger. And if you pop the tip of your thumb right between your eyebrows and then you place the index finger up, that should be where your hairline is. If that is considered a normal anthropometric sort of measurement, without going into high-tech measuring tools. This is a very high-tech measuring tool.
Very high-tech.
And then the second third, which is classically short with a lot of people who have had very poor nutrition through their generations, and that doesn't have to be, it can be passed down there through the generations. So your parents may have had really bad food.
My mum had terrible food.
Yeah, and they went through these really bad times with not being able to get nutrition. And so they had cord facial development. And if you want more information on this, Nutrition and Physical Degeneration by Pottinger is
Weston A. Price.
Yes, Weston A. Price, I'm sorry.
Thinking of Pottinger's cats.
Yeah, both great books. But Price found that, a lot of people with the middle third that was very narrowed, and it's like the face was kind of hanging from their forehead. It was a long, thin, narrow face. They didn't form a big enough maxillary ridge, which is the top where your top teeth sit in the maxillary bone and your bottom teeth sit in the mandibular bone. So they found that was very compressed in that middle third. So if you put your thumb under the between your nostrils and then put your index finger onto your forehead, your index finger should sit in between your eyebrows. And you and I both have overshot. So we've both got a slightly small middle third. I just have to plug my computer in, Leila. 1 second.
All right. I can imagine what mine was like before my orthodontics. And so, like, something for the people at home is, if with your kids, like, I really encourage you, if your kids need orthodontics, to have someone look at that middle third and go see an orthodontist who actually works on that, because quite often people who have that kind of work done when they're in primary school, they'll just grow better and they won't need to have full-on orthodontics, because the jaw will grow and form under it, which is way, way, way better than having what I had done. I can tell you now, in your 30s having.
Do you therefore recommend at a certain age, when you think, at what point would your dentist have said to you was the best time for you to get that assessed? At what age?
I have a girlfriend who's a chiropractor, and she had her son, he seen my orofacial surgeon, and he suggested around 7. Okay. So they put like a plate in there, a spacer, and every time you breathe, it vibrates and it helps open up the palate and bring that premaxilla forward. And his teeth now, he's a teenager, look great now. And the dentist that I work with in Sydney, because I'm concerned about Ashanti as well, because it's obviously genetic. I can see that she's got quite a small palate already. Yeah. He said to me, probably when she's at mid to late primary school, depending on how they're growing and that kind of thing, and how much is bothering them too. Like, I know she has a little bit of an issue pronouncing some words, and chewing and stuff. So, I had so much issue chewing. I remember I could never actually bite spaghetti because I could never get my teeth to match.
Yeah, and if you don't break down your food with your teeth, your back teeth, so your teeth are like these little crystals. They create a piezoelectric effect, which almost kind of has a stimulatory effect on massaging the covering of your brain. And the covering of your brain there's a dura. The dura is the sheath that covers the brain and covers the spinal cord. And those piezoelectric crystals that are your teeth, as you chew your food, they massage the brain. And quite often with some people where they're chewing constantly on one side, it can literally change the shape, especially if this is in someone who's still developing. It can change the shape of the fascial tension on the brain and can change the brain. And, you know, sometimes I think about these. I've got a young 16-year-old at the moment that's got terrible migraine. She's had them constantly for 2 years with, 8 out of 10 pain and nausea. And her life is just really on hold. And we're really doing a lot of work now with her, looking at her cranial bones and trying to get the plates up in the skull and the ventricles inside the brain, getting them moving, because she had a classic bottle fed, sort of top lip was pulled up, teeth didn't come together. So there was a huge issue through there, and now she's presenting as a 16-year-old in a really bad way. And so we're really having to go deep with this totem pole assessment to make sure that, you know, she's going to be able to be helped. It's awful. And Leila, I have to say, when you had all that orthodontic work and I was sort of coming and staying and working with you a little bit, I was amazed to see, because I would never have believed it without having seen it, the change in your face. I remember when your cheekbones suddenly rose, they popped. Like, you know, is that orthodontic work widened your maxilla and your palate widened? It changed your look so dramatically.
It did change it a lot.
I was like, okay, this is really
well, yeah, to think that you would have it on like that much change on a fully grown adult, you know, in my 30s. And it happened actually really quickly, that first part. Like, it was almost too quick. It was quite a shock to my system.
Yes.
It happened very quickly. And this is the thing too, to understand about the body, like having someone who understands this holistic viewpoint. The dentist that started my work, passed away, God bless him. He really was a fan of the totem pole. And he said to me, I wouldn't perform this on anyone else but you, because I know that you're nutritionally sound to deal with this. And also we're going to have a good result with it, because I know that you've got the right bones, you know, nutritionally, you're feeding your bones and they're going to be able to cope with this. And because the pain was intense, it was really intense. But I remember when that premaxilla came forward, I actually lost a lot of puffiness. I also looked leaner, if that makes sense. I lost a lot of puffiness because of the stress on my body for all of those years of not being able to breathe properly.
Yes.
And then I had to go through breathing retraining. So luckily I know how to do that myself, because I actually couldn't breathe through my left nostril properly. So I had to spend quite a lot of time retraining my left nostril. And I made a commitment to do that. I didn't feel like I needed to see an ENT. I just think that I just had to do that myself. So doing a lot of alternate nostril breathing. And then I also worked with an optometrist, a behavioural optometrist, because the shape of my eye kept changing so much that my prescription kept changing. And she gave me a lot of eye exercises to do, because I had this really droopy, lazy looking eye. So I had to do a lot of work with that. And
it's really amazing. There's someone that they're quite hard to find, and yet when you do find someone, use them, because they're really great for
she's amazing.
Development with kids as well. Yeah,
really important with children to get their eyes popped.
Just had a car accident.
Yeah. And then now I'm still not there, because, and this is the key thing, I've lived in a way for 35 years and I now have to detrain that. So there's some things that I noticed that are better. One of the things that I really noticed that was better was I definitely think my ability to have a vaginal birth without any trauma was heavily.
They talk about, there's some osteopathic schooling that talks about the mandible relating to the inferior pubic ramus as it comes together for the symphysis pubis. So if your jaw, it's sort of that whole concept of as above, down below, where you kind of mirror dysfunctions in the upper body, and it presents some in your pelvis and down into, even your C1 vertebrae relates and mirrors L5. So if something's going on up at C1, you may see that presented in L5 as well. If something's going on in the jaw, it may relate to that pelvis. So absolutely, that ability for your pelvis to open when you gave birth to your daughter, it would have been so much better, just based on, one, your health of your overall fascia, and two, the alignment of the jaw and that freedom. I mean, it's amazing.
Well, I mean, Ina May Gaskin, that beautiful midwife travelling around the States in her bus, and now has that commune that you can go and stay at to give birth. She talks about in her book, it's such a beautiful book, about opening and really, chanting or singing or something in labour to help open up the airway, open up your jaw, to encourage the pelvic floor to let go. So you just don't think about all this stuff going on, like the ongoing pelvic issues that I had, and always having this really tight left obturator internus. Do you know how hard it is to get someone to release your left obturator internus? You don't want to be doing that forever.
That's a muscle deep down in your pelvis and your hip, in case you're wondering.
And the best way to do that is like internally. I would have always been having issues with that had I not had this work done with my jaw. So I was, because I could never make contact, and obviously you got to look at what is your goal? What do you want to get to? Like, I love physical exercise, and I love pushing my, challenging myself with strength and gymnastics kind of work. And so I wanted to be better at that because it gives me so much joy. And so it would just annoy me, because I would know that if I just could get my back teeth to meet properly, I'd be able to deadlift so much better.
Yeah. And you made a really interesting point before about feeling like it all happened a bit too quickly. There's one thing I have learned over the years is really fast change is actually really detrimental to a lot of your body. First of all, your nervous system has to kind of reorganize its ability to fire muscles and their new length. And the other thing is, if people change their tension of their fascia, the fascia is the sheath that covers the muscle, it's the ligaments, it's the tendons, it's the stuff that covers your organs. It's like a continuous structure through the body, and it's very alive, it's very water dependent. But if you have a huge change in your fascia, for example, I try not to let people lose weight too quickly, because I've found that it completely destabilizes them. And if they've got a neck or a pelvis that keeps shifting and they keep hurting themselves and they're losing a lot of weight really quickly, it's a really big challenge to actually be able to stabilize them. And so I think that was one of the really strong things I learned from Guy Voyer, is don't make changes too quickly. And so, this whole impatience thing is like, let's go, kick the butt for 30 minutes in the gym and try and get changes to happen really quickly and fast for this many days to change our weight or whatever you're trying to do. Who knows? It's all wrong. You have to really care for your body in a timely fashion, and you have to be really realistic about change. And the other thing you see in the gym is people jumping to Olympic lifting without having a base of strength. Like everyone who's gone into the CrossFit industry, and in 3 weeks they're doing Olympic lifts, and they haven't got any sort of strength base, and they haven't even done 3 months worth of lifting, let alone 3 years worth of lifting to then go and throw weights around. It just really scares me, and I think that people are slowly learning in that community that you can't go quickly, because there's so many injuries going on, and I think that we have to have moderation in our lives, and so many of us are not prepared to do that. And if you don't have moderation, then you're just going to go and just, I don't know, beat your head up against the wall, because you're going to have just another problem happening. So,
well, look at all the problems I have now. too much change. Don't have a baby and get your whole face reconstructed and live in a mouldy house all of a sudden. We can laugh about that. I don't always laugh about that, trust me. So, and I guess what I love as well about the model that we've learned is to create programs for people to come out the other side of that. Because I think one of the problems I've seen with certain types of therapy is just, okay, you're not in pain anymore. So I don't get migraines anymore, for instance. Off you go.
Yeah. And
then we wonder why our shoulder hurts. You know, like I was saying yesterday, my overhead press is really weak in my right hand, and that's, you know, new. And so that's really to do with my jaw and my neck, and, you know, and so now I need a program to retrain my body to sit in this new position under this new jaw that I have. I can't just get a new jaw and then go out. You know, it's like when we get breast implants and they don't realize like the heaviness of breast implants and how it changes their upper body and the work they need to do to maintain posture with these things hanging off your chest. I wonder why they get back pain afterwards.
It's not just boobs either. It can be hair extensions. I mean, hair,
yeah, I know.
Even hair, it can be too much for people with weak necks. You know, so boobs and hair and, you know, all the other things get added. But you're right, having a structured program is really important. But Leila, I would say again, right now, you'd want an assessment. You want to know why, because you've had all this change and your body is different now.
Yeah, so it's so different. I need another. Jacinda, just open in 2 weeks. I'm coming to see you. Jacinda just opens the bubble. Going to cry.
Come to New Zealand.
I come to New Zealand.
But I just also, in continuing with that totem pole, after looking at the jaw, we sort of have to look at the next thing. You know, back in the caveman days, your vision was super important, and your hearing, and also your balance, your sense of balance, to do with your inner ear. So part of our assessment is to look at the eyes, and, you know, you've brought up that really good point about how your jaw and your eyes were connected in the dysfunction, and the hearing. And classically, when I'm dealing with people and I'm looking at how they're watching me and they're talking to me, and quite often I see people when they're using one eye to look at me, or they're making appointments on their phone and they're using one eye to look at their phone. And right there, for me, is a real alarm about, well, if they're rotating at the head, the pelvis is going to follow it. So if they come to me with a sacroiliac or a hip issue or a knee issue, I'm going to look at why are they turning their head constantly, and what is that eye doing? What is the other eye not doing? Do we need to train them with a mask over the strong eye, so that an eye mask, that is, over the strong eye, so that they learn to use the other eye? Or is there something going on visually? And, you know, I'm not going to be able to correct somebody's pelvis if they keep rotating their head to use an eye. Same with hearing, and same with balance issues. We have to get those cleared before we can really start, you know, thinking about what's going on in the lower body, because ultimately down the totem pole, right at the bottom of the totem pole, is what we call the slave joints. And the slave joints are the slaves to the main sort of control centers, and your upper neck and your head and your pelvis are really big control centers. So the slave joints are the joints like your feet, your ankles, your knees, your hips, your shoulders, your elbows, your wrists and hands. They are the ones that take the hit. They're the ones that have to compensate for the stuff that's going wrong in the control centers. So quite often a lot of us are dealing with people with low back pain. Well, that's a slave joint. So you have to look at, why is the low back getting irritated? And further up the totem pole, after the ears and the eyes, is where C1, which is your atlas. It's the top vertebrae, sits on top of the head. Well, the head sits on top of that, sorry. It's like Atlas holding up the world in his hands. So your head sits on C1, and C1 and C2 are extremely they're very, very mobile joints, and they're not really stabilized by bony interlocking where the bones can help stop them from over moving. They're really stabilized by muscles. They haven't got a huge ligament structure up there also to stabilize them. So that's that's a big factor in driving a head position into a side bend or a rotation or a shift sideways. And then whatever the head's doing, the pelvis will follow. And then you can often get a weight shift onto the side that the pelvis is shifted to because the head shifted. Let's say you had a hit in a rugby game, or you were playing football and you headed a ball and your neck got shifted to the right. Well, your body can't, and your head tips to the right as well. Well, your brain says, no, I can't have those eyes off binocular vision. You got to get the eyes level with the horizontal. So what it does is it shifts your pelvis to bring your head over straight, and now your pelvis is shifted out to one side, and you are at risk of a disc injury. So these people that come with low back pain and disc injuries, is it because of something that's gone on further up? And this is what I love about this problem solving. It's hard work, don't get me wrong. It's never easy. And I still have clients where I spend an hour with them. I'm like, I'm going to have to see you next week. I mean, in the next couple of days to keep going with this, because we haven't quite come to the result yet. And it's really frustrating for them. But when someone's had something as long as they've had, they are quite often happy to have someone just try to get in deep and find the answers. And ultimately coming down from the upper cervical spine, which is that C1 tooth and then C1 in the head joint, coming down from there, we've got to take into account the organs, because each organ has an ability to, it holds hands with the nerves that feed the organ, often hold hands with a certain part of the spinal level. And this is how organs can influence limbs. So as you know, if someone has a heart attack, they often get left arm pain. If someone has had too much coffee, or they've had a big night out the night before, a drinking session, and their liver's unhappy, the viscerosomatic reflex is that it will affect the neck, and it will affect the upper mid-back. So the liver is supplied by the T4 to T9 nerve roots, and also influenced by the mid-cervical spine or cervical spine, depending on whatever country you're from. You wake up in the morning and you crack your neck a lot more because you've got this dysfunction at the liver that's driving neck tension or destabilizing your neck. And you can often hear people describing organ dysfunctions, and then if you know where those organs, which nerves are feeding those organs, then you can often find out why they've got an issue in that area. So knowing about food and what people are eating, how their digestion is, how their hormonal health is it an endocrine organ that's driving dysfunction? Like the thyroid is right here in your neck. Will it drive the instabilities around the collarbone? Will it drive issues around the neck? Will it destabilize the shoulder because it locks up or changes the collarbone function? We've got your adrenal glands, which are sitting right above your kidneys, so that may influence your ability to contract your upper abdominals. Will it influence your calf, as in Chinese medicine says? So the organs are really, really a big driver for musculoskeletal issues, and it's really important to not forget you've got to go internally to help that physical body. If you feel like you've had the best program, that you've done a great assessment, you've written the best program, you've done the best treatment, and nothing's changing, you need to go in, because ultimately the organs are number one on a priority of protecting them, right? And if you have an organ that's unhealthy, your body's going to try to fix that before it will fix the physical body. So you can try really hard to fix the physical part of the body, but if it's driven from the organ, you're just going to, again, get really frustrated, and so will your client.
I remember I've had a couple of teenage athletes actually with hip problems that were to do with digestive issues.
Hip problems.
This hurdler, he was a great in the field of athletics, but he was really struggling with hurdles, with his trail leg, getting his trail leg over the hurdle. And when he came to see me, I was having a feel around his tummy, and I could feel this, great big poo sitting in his colon. Yeah. And I asked him very politely, I shouldn't want to tell a 16-year-old boy I could feel a great big hard poo in your colon. But, you know, understanding the relationship with the colon and the hip flexor and all of that stuff, it can start to problem solve for him why he's been having all this therapy on and training and not getting a result from his program and still having a problem with that trail leg on his hurdles. So for him, it was writing a whole nutrition plan for him with his mum, and getting his bowels moving more regularly, and then the training program that he had with the different practitioner, it was working. I didn't actually need to train him. He could just keep working with that person. There was nothing wrong with that program. Like,
it works. It's amazing. It makes our job that much easier. All we have to do is assess. You can see like the sun's gone. I have to turn the lights on now.
The sun's gone.
Once. That's better. Hang on. Sorry, Lena. I'm back.
And a similar thing with a rower that I had, and she was being presented with low back pain, and the physiotherapist that she was working with had given her mum the study of flexion disorder in rowers. And so I was just trying to treat her based off this study. But when I was actually looking at, you know, sometimes when your old videos come up on your phone, I was actually looking at her video the other day, and I had her on the erg in the studio, and I was watching her. She could not keep her right leg straight in the foot compartment that you have to. So she was really like trying to drive this right foot out into external rotation. And it was also a problem for her on the side of the boat that she rowed, because obviously when you're on an erg, it's level, but when you're actually rowing a boat, you're a sit on an angle. And this physiotherapist was saying that she was unable to keep her foot straight, so he was getting her to do all these single leg squats and just trying to make her straighten up the leg. And it was, of course, the program that the physiotherapist was giving her was making her back pain so much worse, because she was trying to get away from that hip that was so jammed up. So, you know, being able to assess her hip and look at the way the bone moved, you know, the range of motion, and feel what it felt like when in that rotation. It was really like it wasn't bony, it was like leathery, this feeling of the tension in there. And then going through with her mum, you know, like what's going on in life, what's stress. She's like, oh, she's got stomach problems all the time.
Right.
And so able to then, at the time, I didn't do as much nutrition stuff as I did, so I referred out to someone to do that, and she had all these kind of digestive issues that needed to be worked on. And then again, it was sorting out those digestive issues and her coming back and getting a training program to get that range of motion back in the hip, and then the back pain went, and I didn't even touch the back.
So that's the thing, and this is where here's just a little bit of extra for experts as to why that happened. So the viscerosomatic reflex from the digestive system, so the small and large intestine, and the gut, it reflexes to the deep abdominal wall. And it's almost like when those organs are inflamed, the abdominal wall has to create space, has to release so that you can create space for those swollen organs. So the core gets shut down, it gets down-regulated. And that means, and that deep transversus abdominis muscle, which runs like a corset in a transverse direction from your lumbar spine right around to your low ribs and right down into the lower pelvic region. So that will be shut down. So now the brain's saying on that leg side, potentially, there's no control around the pelvis. So she may, because she was probably one-sided dominant, she may have kept letting her pelvis go anteriorly on that one side of that externally rotated leg. So when your pelvis shifts anteriorly into a kind of, it's like if your pelvis is like a bowl of water and you're tipping the water out front, that's an anterior pelvic tilt. So let's say she on one side, she had an anterior pelvic tilt because she had no core control holding that pelvis in position. So what then happens is the brain's like, that joint's unlocked, that's in an unstable, unhealthy position. And so what it will do is try to increase the tone of one of the hamstring muscles called biceps femoris. Now, biceps femoris attaches at the pelvis and runs all the way down to the outside of your knee, your fibula. It runs to your fibular bone, which will then be pulling your lower leg into a turnout. So the foot sits turned outwards, and it happens at the knee. And yet it's coming from the pelvis, which is ultimately coming as a protective holding pattern for a shutdown core because of an inflamed gut. Mm. So you can see the whole connection of gut to abdominal muscle to hamstring overactivation to try to stabilize the pelvis to then that turnout of the foot. And that turnout of the foot and that fibula will also drive for that kid eventually, if they didn't get that sorted, a meniscal injury in the knee. So now you've got a knee that's presented because of a digestive issue. So you can see that beautiful connection of our body. We have such a cool body.
So cool. I really love it. I really love it. But I also love because it helps you set a limitation for a client, because like I said, like not everybody is going to go and get $20,000 worth of orthodontics like I did and go through 4 years of pain. And, I've got a client at the moment that you've been helping me with who's missing her incisor, her right incisor, and has had a compromised airway. And she's got a lot of stress in her life, like so much stress that's driving quite a lot of emotional stuff. So I know, and like the dentist said to me, she's not going to be able to cope with that kind of treatment that you have. Mm-hmm. So all we can do is try and open this airway up for her. So she's not able to have the other work, nor does she want to. She's nearly 50. She's not, I was 30 in my 30s when I had that done. And also, but, understanding that she really needs to put on muscle mass at the stage that she's in her life. But knowing that I can't have her doing a typical exercise program, because every exercise program that she's done has completely exhausted her, because she's so challenged standing up in space just on her own. Adding load onto her when she's standing up is going to just really compromise her. But knowing that she needs to put on muscle mass at her age, we all need to. So I can help her do that because of my knowledge in a way that's not compromising her system, because I'm not sure how much better she's going to get in terms of being able to fix that rotation anytime soon. But she's coming up to menopause, and, so I've got all these things in my head. How far can I take her? What program am I going to give her that's actually going to give her benefit? Yeah. And give her a sense of feeling strong and empowered, and, and help her cope with the stress in her life, because the stress in her life is not going away anytime soon, and it is something really stressful. Mm. So working on her nutrition, working on her sleep, getting her stronger in her body in the state that it's in, so she can actually cope with the stress of her life better, whilst all the time having in the back of my head these things that I can't change but I have to respect. It's like trainers going, well, that client squats with their feet turned out, and I was taught that when you squat you should have your feet in parallel, or you should have them at 45 degrees. Being able to understand, well, why does that person squat like that? If they train, why do they get tired? And how am I going to be able to respect them in that place and time while still keep them moving? Because movement is so important. So it's not about always, I think, having the answers, because sometimes you can't have the answers. But, movement is something that was made up by man to compensate for a life that we were supposed to live, that we're not living anymore.
Absolutely. And the joy and the love of movement and the feeding of each other with that it's really what we're here to do. We're slowly dying this sort of, we're losing our fire because we're losing our movement. We're not going to die with a big bang. What are they saying? We're going to die with a big yawn if we're not careful.
That's so funny. But I've really connected with that lately, because I've, what's been going on with my health, and I share a lot about it on my Instagram and stuff, is that I really had to connect with why I like movement so much. Because at the moment it can't be about weight loss or, it's got to be in this kind of limited way at the moment, so I'm not, challenging my physiological load anymore. And it's really made me look at why I got into movement, because I didn't come from an athletic background like you. Yeah. Actually came from, and most of my school friends, when I see them like now later, and I tell them what I do, and they're like, really? So I didn't think you would do that. And what I loved about movement was when I was a drama student, so I actually went to university and did drama performance.
I didn't know this.
Yeah, didn't you know this? So what I loved about it was that it got me into my body.
Yes.
And it was very much, and I didn't really realise this until I really got into wisdom of the body moving, that we have to study in the CHEK program, and understanding how much trauma I had grown up with and how movement actually connected me with myself and made me want to be in my own body, whereas for a very long time I hadn't. And so I think it's really important with, it's helped me reconnect with clients how important it is to move, because I think you can get pulled away from that. Like you learn all this stuff about this holistic thing and tissue work and, chakras and meditation and blah, 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 blah. But the thing is that we don't move as much as we physically need to, and how important that is for your emotional well-being and how to be in your body.
I saw this in my work, because I really just wanted to get my hands in there and just really treat people and work on them. And it would always be a little bit, ultimately, even though I wasn't ex-athlete, I never went to the gym. I never ever stepped inside a gym until I met Paul Chek. And even then, on my first day of going to his certification program, I turned up in a dress. I had no idea what I was getting in for, and I had no idea about how to design programs. So anyway, it was my first call was always, when I was struggling with someone, was like, oh, go and treat them. But every now and again I knew, or I'd have a client who'd say, listen, I really want to exercise. And I'd be like, oh, okay. So I'm like, oh, shit, I got to go in the gym. And ultimately that was when I would always see the best benefits, because treatment is passive and a workout, the body learns. And, I've just really shifted now to try and get so many more of my clients working out, and it's a treat for them to get treatment now.
Yeah.
And now the results are even better. But again, in the situation with your client, who you've got to work really carefully with this torsion, she's got a rotation that potentially will be magnified if you strength train her too much. But if you take her gravity out of that picture and you lie her onto a Swiss ball, or you lie her on the floor, or you train her on hands and knees, or you train her lying on her side, and you can do a bunch of strength work there. You can be really creative with it. Mm. You can still give her an element of strength without potentially magnifying that disruption that's going on in that body, because you've taken her out of gravity. And I think that there are many ways to work with your program design with clients where you think, oh, I can't exercise this client because they're way too crooked. Well, it's about having the braveness to say, your body needs the stimulus of movement. It may hurt initially. We will work with you on that. But you have to move, and you have to get them to make that commitment to their movement, because movement is learning. And like you said, it takes you into your body. A lot of the pelvic issues I've had with a lot of the females I see with the sacroiliac joint dysfunctions, really, the stronger they get, the less that pain is there, and it is amazing. But I'm also a huge proponent for high levels of protein. Mm. And if you're plant-based, then high levels of amino acid supplementation with your meals, and resistance training, especially with myself in my 50s and, your menopausal woman and your postmenopausal, we have to combat that muscle mass loss hardcore. I mean, I remember Paul Chek talking about it as he turned 50, and I was still sort of I think I was 40, saying it's really hard for me at the moment to exercise and maintain my muscle mass as I'm getting older. I can really see it going. And he is still in amazing shape and lifts really heavy, but I didn't kind of get it. I was like, how's that possible? But it's really true. Your muscle mass loss is so big, and I love the fact that if you get in the gym and you do some resistance work and you have a good amount of protein in your diet, you will really see some amazing changes. And, just get in there and give it a go. I think, ultimately 3 to 4 times a week of resistance training is really important for menopausal women and perimenopausal and postmenopausal, and also men if they want to keep their testosterone levels high and keep happy. Then we have to really make sure that we address that factor in our lives.
Yeah, and it's understanding. I think it's being conscious too as well of like the things like HIIT and all these high intensity stuff, like doing that all the time is actually still people being out of their body.
Yeah, and they can actually potentially lose muscle mass doing that type of training. You don't, as long as you can undulate or periodize your program so that you have periods of lifting and getting strength and then go into the high intensity training or work in the week of it within your week with resistance training, then you don't run the risk of losing so much muscle mass. But I've seen people who have lost a lot of strength. They'll still be toned, but they will have lost a bit of size in the muscle by doing too much of that type of training.
And we're so obsessed with being thin. I was actually just making a video today about weight loss, and I was looking at a DEXA scan of one of my male clients. And what I can see happening over time is that he's that person that loves that high intensity stuff, and he's actually doing way too much exercise, not eating enough food, and he's losing weight, but he's also losing a lot of muscle mass. And his bone mineral density on his DEXA scan keeps going down.
Right.
And that's a man, and that's not very common. It's more common in women, but he's pushing himself so much to the extreme with all this high intensity exercise and not eating enough calories and not eating enough protein, especially not eating enough protein.
Well, so it's the type of protein in the sense, has it been commercially farmed? Is it a good quality protein that actually will be feeding you, as opposed to one that is an unhealthy protein or a synthetic protein that's come from a powder?
It's actually like having a lot of vegan protein powders. So
I don't want to go down that rabbit hole.
I don't want to go down that route because it's too much.
Supplementing with branched chain amino acids is important.
But it's this whole idea of holism is about looking at all of those things for a client. It's not just about, and so I actually have swung back to getting a lot of my clients to get DEXA scans now, so they actually have a look at their muscle mass. I don't do calipers and body measurements and stuff.
Yeah, that's good.
Because so many of my clients have this fixation. I was doing a video about this today on a certain weight that they should be, and he's had this fixation. I actually think if he put on 10 kilos, he would be a lot healthier. Yeah. But it's the way that you put those 10 kilos on. So getting really finite with all this data and program design and keeping your clients accountable and teaching them all about these holistic aspects of, it's not just energy in, energy out. And you can't even just say to someone, just eat organic food, because they could just go and eat organic salad 5 times a day.
I think the great thing about you suggesting the DEXA scan is and plus doing the assessment is I tell people the numbers, and they see the numbers, they see it there in the DEXA scan, and they see it on your assessment, and that motivates them. So they'll quite often come in and go, oh, can you measure my lumbar curvature today just to make sure we're heading in the right direction? I'm like, yep, let's do that. Because that's what's motivating them. They've got data that they can influence. And if you're really number driven, then those people do really well with that sort of information. So it's that's a great idea to have that DEXA scan as part of a complement to what you're offering.
And I think it's understanding all that for a client too, because, I've been getting a lot of women now who are postmenopausal, perimenopausal, postmenopausal, having really horrible injuries like disc injuries, and one, client that I'm still dumbfounded about, and because I've only just started working with this dentist recently, and him wanting to put in dental implants and her not having the bone mineral density to be able to accept the implants, and this real lack of understanding of how much nutrition and lifestyle contributes to that. And that she's not an unhealthy person, but she's been so fixated on weight loss that she just hasn't eaten enough food. And so she's had this thin body that she's always wanted, but it's deteriorating because it's depleted in minerals and, doing Pilates, I'm really sorry, but it's just not enough. Like, she should have been doing some strength training. And it's really sad to see that. And I really hope that we can really focus on our young people, like the athletes you were talking about that you and I have both seen in their 20s, of really getting their nutrition really, really solid and their recovery really, really solid, and really understanding that you don't get stronger, leaner, fitter, better in the gym. You get, like, at home. Go back and listen to that podcast with Mark Buckley. He really slammed that down. More is not always better.
Yeah. And this has been a really big challenge for, in these times we've just been through, with people not being able to get the sort of resistance training that they want because they can't go to gyms, or they, literally in New Zealand you couldn't buy weights equipment. It was completely sold out.
Yeah, same here.
Yeah, it was sold out last April and it's still hard to get. So, you got to be really creative with that. You got to put, like, rocks in your backpack, or put your friend on your back and do squats while you're piggybacking them, or, you've got to find some way to create that resistance. And you've got to make yourself move, even though you might be in your house or limited to where you can go. You've got to, simply bear crawl to pick up the remote to change the TV channel or something. It's just like hop to clean your teeth, or, jump off things. And
we've got we're in our new house with 3 stories, and I make it purposeful so that when I need to go to the toilet, I go to the toilet on the bottom floor, so I have to do all the stairs to come back up. Because otherwise I'm just sitting on my butt all day, because I just do online now, and I used to just do face-to-face, and I was on my feet all day before, and now I'm all online. So I'm constantly thinking, cool, how am I going to get my extra steps in and, do the stairs 2 at a time, so I'm working on my glutes as I go instead of just sitting on them all day.
There's data showing that really, if you want to keep your metabolism and your blood flow normalized with sitting, that you got to move 2 minutes every 20.
Yeah.
That's quite disruptive for people that are trying to work.
Yeah. Well, I've actually started wearing a fitness tracker because I get so engrossed in my work, or so that's me. I'm like blinkers on, can't stop. And I'm like, I haven't moved for like 3 hours. So I've now got this, you need to get up and go for a walk going. I noticed it too with Sean because he always goes to the gym when he's in the office in the city. And then when COVID happened, he was just running all the time. And then just recently he landscaped the garden.
Yes.
He's like a different person.
Yeah. Well, I had to move house the other day, and I just kicked in and helped the movers. They're like, we're going to give you a shirt. We're going to give you a power mover's shirt. But I felt so good. And actually the other day I went and joined my kid on a trampoline. I honestly don't think I've been, because that was my sport, right? I don't think I've been that energized at night in ages.
Right.
It was on. And it was going back to movements that I knew. And I think that's potentially what we try to do if we're struggling to get moving, is go back to the sports that you know from your youth, and your system will know that, and it will know it pre all these postural deficits, and maybe you'll actually respond really well to it. And that's also why I quite like the Swiss ball, because it challenges your protective reflexes, and it makes you have to actually be more alert in an exercise environment. You're not in a supported environment at all. And, I think that there's a real benefit to just going back to what your body knows, or put your body into a slightly challenged environment. Look at how active kids are. They don't like, but my kid's really bummed when I walk with him to school, because he is on a scooter and he wants to scooter as fast as he possibly can there. Like, I'm just like cruising with him saying, well, just walk with me. And he's like, no, I want to go really fast. So that's how kids were. Remember how they moved? They were like super fast all the time. And we were the same. We ran everywhere. We didn't walk.
No. climbing up everything. And
yeah. And we just need to make ourselves go into that and make ourselves get a little bit childlike in our movement patterns and, climb the fence, jump it, hop it, whatever we want to do. When you get to the park and there's a little, swing set there, or a slide or whatever, just go be a child.
Because, a lot of our dysfunction is from a lack of movement.
100%.
Poor nutrition, not growing properly, lack of movement. And now we're seeing, I don't know about you, Suze, but we're seeing so many people with neck issues because it's exactly what you're talking about. You're sitting in front of the computer all day, on Zoom all day, in that forward head posture, and then the jaw's getting pulled back. People have got this jaw tension now because they're grinding their teeth and clenching them. And
I've seen loads of shoulder injuries because the rib cage is the foundation for the shoulder. So if your rib cage or your curvature in your upper back is increased and your front panel, your sternum has dropped, now your shoulder's out of alignment. Your AC joint and your collarbone is now under compression. You start getting I've seen so many clients at the moment with shoulder issues, and they're just really annoying tendinitises or impingements because of the position of the head, upper back and shoulder from sitting all day. And I constantly ask people to send me photos when I see them of them at their workstation and then at their home workstation. So, this is a really big issue. And, lumbar spine's really curving and flattening out. Pelvis is hamstring getting really short and tight. There's a lot going on. And all the extra baking that goes on when you're in lockdown.
All the chocolate we've been making.
The cakes. Yes.
Chocolate. We know how many people come into my office because everyone wants to come over and see our new house, and they always say to me, "Oh, is that your chair?" I'm sitting on a Swiss ball. Yeah, I've sat on a Swiss ball at a desk for, 20 years, I think.
Right, so you must have some really good endurance there, because I say to clients, I'm like, okay, if you're going to sit on a Swiss ball, just give it a good 20, 30 minutes and get off it and change into a chair, because your nervous system is so from it that quite often, they get really achy.
Well, 20 years, yeah. You know how it happens. I broke my coccyx snowboarding, so I had to sit on a Swiss ball.
That's good.
I never went back to a chair. Yeah. Every time I sit in a chair, I'm like, this is so uncomfortable, man.
I think
my bum's better, but it's just really uncomfortable sitting in a chair. So I guess we're getting into having a laugh now because we're.
I know. I was going to say different. Butt's better.
My coccyx isn't sore anymore. I can sit in a chair, but I just don't like them.
I just want to say that I am super proud of the fact that you didn't swear at all on this podcast.
Hang on, I'm still recording.
And because you didn't swear, I didn't swear.
You didn't swear. I know, because we're good friends and we say some silly things together. Do we don't? No. So what we want everyone to leave with today? What do we want everyone to leave with today, Suze?
Well, what do I want? I think don't accept when you go to see someone for your injury or your pain, don't accept anyone who is just not looking at you as a whole person. And make sure you speak that. Make sure you say to them, I want you to look at the possibilities about where is my pain coming from. And if they don't know how to, that's okay. That's just where they're at with their education. And simply by you saying that will help them learn, hopefully, if they accept responsibility for that. But you need to try to find somebody who has an ability to look a little further afield. And definitely the CHEK practitioners in your area will do that. But you may also find some other people who just naturally really know how to look that way and assess. So really, don't accept anything less than that, because you will end up just, I was going to say something really rude, actually, like just send your money in the wind.
Yeah, that's right.
Okay.
You can say that. But I think also it's like someone who's looking, you have to be really conscious of what you're not looking at yourself.
Yes.
Like people.
You have to let that person let you speak.
It's, another thing Buckley always said was first Before you seek to be understood, first seek to understand.
Gosh, he's got wise in his old age.
Yeah, he's quite wise. He still is annoying, like a pesty older brother as he ever always was. Hope he listens to this.
I was going to say, I hope you're listening, Buckley. So, yeah, and even then, let the program that you're doing, let it be something that's a work in progress. You don't want to be stuck doing the same program for a long time. Your body really, really hates doing the same thing. Your body really responds extremely well to a stress response. Otherwise, it stagnates, and so it no longer adapts. So adaptation is a really big thing that you're looking for. If you're not stressing your body enough, it won't adapt, and you won't get gains. Okay, so it's really important that whoever's working with you, or even in your own sort of designing of your program, is that you try every sort of 3-4 weeks, maybe 6 weeks. It depends how long it takes you to master that current program. Then you change it out. You change it out by simply changing the width of your grip that you're holding, or you change it out by adding a little different weight. You change out your reps. You might change out your rest time. There's a real science to a program design, and it does take a little bit of understanding. And so it doesn't have to be a huge change that happens to create a stimulus response, but there has to be some change.
And it has to be enough of a stress to make change, but then the recovery needs to be there to make that stress a positive stress.
Yeah. Like you said, like cortisol is a stress hormone that also creates tissue breakdown. And cortisol starts really peaking at around 50 minutes in your workout and really goes through the roof. So watch how long you're working out for as well. Your workout time is super important. If you don't get enough done on that workout and you want to do more, then have a 4 to 6 hour break and do it again in that day. So train twice in the day rather than training longer than 60 minutes.
I think if you're doing those, because there are a lot of people doing those endurance sports, triathletes, and for fun, as a hobby. And really, I think you need to go and have a session with the sports nutritionist like Kira Sutherland, who's on next series, who's an expert at fueling for endurance and managing recovery for endurance, because I think those people take it for granted.
Yes. And that is their sport, that's their hobby, that's what they're doing. It will create issues within the body. But let's say if that is their goal and they want to become an endurance athlete, make sure within a certain frame of time in that year, maybe a 4 to 6 week period in an off part of the season, that you do some strength training so that you have the muscle, that you build up enough muscle that you actually have enough to lose, or some to lose, while you're deep into your season. When you don't have enough muscle, this is when these tendonitis issues or these tears happen in the connective tissue. And that's another issue that will happen if you're going to try and do explosive plyometric, high max strength lifting, and you haven't got a base of strength. Then it's your ligaments and your tendons that are going to be the ones that get the shit kicked out of them, and they're the ones that take 6 to 9 months sometimes to heal. I mean, what a pain that is when you have this great dream and goal of doing this wonderful sport and you've gone and inflamed or blown out a tendon. So make sure there's a base in your strength, and for both endurance and for both explosive, Olympic type lifting, plyometrics, sports that potentially do create a loss of muscle mass over time.
And especially understand things like HIIT is meant to be like a once in a week session, not a 5 times a week session. That will decrease your muscle mass. And now we've got people coming in. So I'm hoping that I'm going to get Suzi out in speaking around the world again. Why do I have such big dreams for Suzi? Because everyone needs to learn from Suzi. She taught me so much. So Suzi's available for online Zoom conference.
Like I taught you. You taught me. We both taught each other. Yeah, I available for some online Zoom calls.
She's gone all quiet now. I've already pimped you out to some physiotherapy friends. You're going to do a talk for them on the TMJ.
Okay, I promise next year.
Yeah. So, and if you're a personal trainer or a practitioner, physiotherapist, Suzi does mentoring. She mentors me online, across the Tasman.
And also, you can really, if you can find a IMS course, CHEK courses running, go for it.
Yeah.
And some of the nutrition and lifestyle stuff is done online.
Yeah.
And then if you're still struggling, then you can give me a yell.
The basics. But I think, and having someone like Suzi, like I do, is working, like, it's awesome to go and do the course, and it's not actually till you put it into practice. And especially like me, like I've always been the owner of a studio, the smartest person in the studio. I'm saying that in air quotes. And so I've really felt like I needed someone to challenge me and check in, and because I haven't had someone more senior than me working with me. And I think that to me is really important part of my growth as a practitioner, and also just to make sure when I write someone a program that I'm just not, I haven't stepped into my ego or not being lazy, or just I want the best results for my clients. So, and I've got quite a few mentors now. Like I've got, people I call for different things. I sent Keith Littlewood a bunch of stuff for a client the other day, and he really helped me with something. Like I just don't have all the answers, and I'm not supposed to. And I love that I have this community, like you say, so important, of people that I can draw on and work with. And I love that there's this community of all you guys too that know that, I love in the CHEK forum that people post, does anyone know the answer to this question? And, we're all there to help each other out and learn and make the world a better place.
And also there's a network that you can look for a practitioner in your area. That's quite good too. And we try to really standardise when we write programs the names of the exercises and the findings, so that if I'm working with someone that's come from America and I've got the assessment in front of me and I've got the program in front of me, I know what the exercises are because we've got really similar names to them. And I think that's really important for the trust with the client, and being able to trust that they'll be okay to pass on to another person.
Mm. Yeah. So there's level 4s all around the world if you've got upper neck, shoulder, neck, jaw issues.
And I think that one thing that we didn't really cover in too much in depth over the totem pole was the emotions.
Mm.
And to me, there's a whole emotional anatomy that you can see. But that's something that has come over the years of learning, and emotions kind of show themselves up in the physical body. Is just like the organs can send out the energy to the physical body. The emotions have the ability to also create dysfunction. So that's another whole little rabbit hole we can go down one day if we want. But
maybe we should do that series 2.
we haven't talked a lot about that, but it's a very big part of what I do as well. But again, it's another whole area, and I think that you want to be really practiced in the musculoskeletal knowledge and awareness and assessment, and then you go into the, what the organs might be doing, and then you use the totem pole in that way, and then you look to the emotions if you don't feel like the emotions are the primary cause. Mm. It's very important to also know that whether you think there's an emotional drive or not, the physical body will have reacted to that. So that physical body will still need to have the assessment, and will still need to have the issues or the faults addressed while you're working with emotional dysfunction. I do not believe that the emotions alone and working with those will completely clear up a physical issue that's been there for a long time. I think you get dysfunction in the physical musculoskeletal body with emotions, and they also need to be worked on.
We'll leave you with that, everybody. Maybe we'll have to come back. Maybe that's what we can talk about next time.
Thank you, Lila. That was pretty cool.
Thank you so much for coming, Suzi. Check out Suzi at sweet7.co.nz.
Yes.
And if you're in New Zealand.
I have fish and chips.
Fish and chops.
You can't come to New Zealand yet because you'll have to quarantine for 2 weeks.
Not from Australia. Yeah.
Thank you, Leila. That was amazing.
Yeah, thank you, hon. I'm Leila Lutz, and you've been listening to The Body Never Lies. If you haven't yet, please go to your favourite podcast app and subscribe, rate, and review this podcast. All the resources and references from this episode are waiting for you on my website, leilalutz.com. Just click on podcast and look for this episode. Now join me next week for another episode of The Body Never Lies. Thank you so much for listening.